This is the top 5 best clinical practices for treatment with telehealth. So, just so you know, we're looking at what's the main 5 things that we have to do clinically to have the most sound and ethical practices right now as we're going through this situation. Number one, it's not necessarily a clinical skill in this modality. It's on the front end, but it's really important just to be sure that you're in compliance with your licensing board and you have the proper informed consent. The language is different in the informed consent when it comes to telebehavioral health. I refer everybody to SAMHSA Tip 60. This is a wonderful starting point. And if you're new to telehealth and you don't know where to go, that's a great place to just at least get some sort of groundwork. But the biggest thing that I've learned when I'm learning about telehealth some years ago is your malpractice insurance has to include telebehavioral health. Every insurance is going to be different, so some are already including it with their policies. But if you're going to be providing professional practices, make sure that your malpractice insurance includes covering you for telebehavioral health services. We want to check with our folks about their online life. People walk in, we see them face to face, but a lot of people that we work with will also have what we call an online life. And those who are probably under 35, we consider a digital native. And then there's some that are older from another generation, and they're considered digital immigrants. So we have to be mindful of what generation they are and what comfort level that person has, that we're going to be suggesting the use of telebehavioral health services to them. So it's very, very important to understand that telebehavioral health therapy or services is not cookie cutter. There are some clinical diagnoses where this modality of treatment might not be beneficial. As a matter of fact, it could be more harmful. So you have to be mindful that you don't just go through your caseload and automatically make everybody go telebehavioral health. You've got to be careful with looking at what issues they're dealing with. You've got some people who are dual diagnosed, and quite frankly, I've got a few of my patients who have a history of ongoing suicidal and homicidal ideations. For me in my practice, telebehavioral therapy is probably not appropriate for those people. You may have to come up with alternatives. You're also going to need to consider medication and the work that the people you're dealing with or working with may have when it comes to psychiatry. So again, it's not cookie cutter. You really have to parse out who could benefit from and who's the safest to do telebehavioral health with, from like a clinical perspective. This is really important. Patient safety, because I can't control the environment, and by a click of a button, they can leave my session. I have to plan for emergencies. One of the mottos is we plan for the worst and hope for the best. And usually the best is what happens in your telehealth sessions. But it's really important to come up with a safe word, a safety plan, and make sure that you get a proper emergency contact. So just to kind of go over a broad kind of safety plan that you could use, I let someone know that I'm going into a telehealth session. And I do this, before my session even starts. I throw a do not disturb sign on my door. I make sure I can see a clock, because depending on the program that you're using to do your sessions, you may lose sight of the little timepiece at the bottom right corner of your screen. So it's really important to make sure all of your own distractions and computer programs are shut down. You've got to make sure that you've got a good microphone, a good camera, and then you invite your patient into the practice through whatever means or platform you're using. But when I start the session, I check out where my patient is. Now, 99% of the time, they're at the address that they provided me and the informed consent. But if I do notice that there's someplace different, I need to check in with them to find out where they physically are. And I need to make sure that I have a decent phone number where I can reach them and they can reach me. And I go over that with them in the first couple of minutes of our clinical session. I ask them, are you there alone? Is anyone with you? Um, so they very well may say, well, my daughter's here in another room. And that's okay. I'm okay with that. And then we just kind of go over this idea of a safe word. So a safe word is really handy because personally I use the word coffee with all the people that I work with. So if my patient says, I need a cup of coffee, I stop talking. This way, if somebody is around them or an earshot of their computer, it's kind of the secret way of letting me know that they don't want the person to hear me speaking. But more times than not, my patient and I come up with a safe word that they are comfortable in using. Ending a session, honestly, it sounds simple. You just click the end the session button, but it's not always so simple because it does happen where you might think you're ending a session and you don't. And you've got to be really mindful that when you do end the session, that uh, you actually ended the session. You disconnect your headset and you let others know that you're off the telehealth session. That it's definitely happened before, and I didn't realize that I hadn't ended the session and there was still a client on, and I started having a conversation with someone, and it could have been bad, but it you just need to make sure that you hit the end session button. Remove that do not disturb sign off your door, take off and unplug the headset, um, and then also letting the other people in your office space knowing that you're off the session is going to be a good way to end every one of your sessions. And you would be surprised at the things that you hear when you think you're unplugged, when you're really not unplugged, or the little things that they could hear if you don't completely sign off. So, just kind of going back to that safe word, I use it when, with the people when they're unable to talk. I also use it when my people are feeling unsafe. Once I hear that word coffee, which is the one I use, I'll wait a few minutes, and very often they'll say to me, okay, I got my coffee, or they'll say, I need more coffee. And we come to this safety plan where we end the session, and then I have their phone number to be able to follow up with them. And it's really important also to have this safety plan, and don't rely on 911 at any means right now. And don't necessarily rely on, oh, you can just go to the hospital. Because of this pandemic, a lot of the rules and regulations of normalcy that we're used to, or take for granted are changed now. And so it's really important to make sure that you have an in case of emergency contact number in their emergency plan. But here's the piece. Most people will put their significant other or parent on the paperwork that they fill out in the office, and that may not be their emergency person when it comes to telebehavioral health. So a real quick example, if I have kids who are in college, they have to identify somebody at the college as their emergency person. And I clinically have to make sure that I have a release of information so that if something does happen, I can reach out to that emergency contact. And finally, the number 5 kind of clinical best practice is just be prepared. You're going to hear different verbalizations. Teletherapy is exhausting. Quite frankly, I would do 6 or 7 patients in a row when I do face to face sessions. Right now, I do 2 hours on, 1 hour off. So 2 sessions on, 1 hour to catch a breather, then 2 more sessions. You speak differently, you observe differently, you listen more intensely. And also keeping in mind, at the click of a button, anything can happen. The patient could leave the session. A family member could walk in. You might have technological problems. So it's just, really being prepared to kind of navigate whatever comes your way. I've even had people sign on to the telehealth sessions in their pajamas or not wearing a shirt or, driving in a car. So you could just need to be prepared to navigate through whatever comes